From Azul Cosmetic Surgery and Medical Spa, Dr. Patrick Flaherty wants to meet you. He's got a couple seminars coming up. Here is when and where. The first one is going to be December 9th, 4 p.m. and 6 p.m. This is going to be in his Fort Myers office. There is the number to call. You need to make a reservation. And then the second one coming up December 11th. That is also at 4 p.m. and 6 p.m., but this is going to be in his Bonita Springs office. Again, you need to call and make a reservation. There's the number to do that there. In the meantime, here's what he wants to tell you about this morning. From Azul Cosmetic Surgery and Medical Spa, I am so happy to welcome back to the show this morning Dr. Patrick Flaherty along with Britton Stein. Good morning.
Hi.
Welcome back. Nice to have you back,
I'm
Britton.
glad to be back.
All right, so we're going to talk about kind of a mid-facelift of what we call it, and it's essentially, I guess, Dr. Flaherty, why don't you start and kind of the idea behind fillers and things that we can do?
Yeah, so as we age, we lose fat from our face, and we actually lose bone and muscle too, but mainly fat. And so we become kind of thinner and more gaunt with age. And it's something that's been largely ignored until recent years when we've had these fillers that we can now inject the face and plump it up and correct some of that volume loss.
Because I think people do assume that we need to kind of be tightened or whatever, but then we forget, oh, wait a minute, that youthful glow, kind of that baby face, is kind of because there is some extra fat in the face.
That's right. It's more of a three-dimensional rejuvenation, so it's not a matter of just tightening. We've all seen that, the overdone facelift on the thin face that looks stretched or windblown. And that can be avoided by adding volume to the face as we age, which can be done with fat augmentation, or more commonly can be done in the office just with injectables.
And then with Britton, this is something that you do a lot. So we're going to talk about kind of the mid-face area. We have a great before and after, which I think really shows how it can really return kind of that youthful glow that we're all searching for. So explain, you know, this woman here and this patient what we're looking at.
Well, she basically had filler in her cheeks. And as you can tell from the photo, her cheek is lifted from the front and also all the way back. And that's why they call it a mid-facelift, because it truly does add volume, and it also can lift the tissue in other areas of the face. That's not always the outcome, but that is kind of desirable in some cases if you don't wait too long.
And you were saying the mid-face area is something that people not necessarily, it's not like they come in and ask for. They don't really realize it's an option, which I think is so cool why we're talking about it this morning.
Yeah, I think I do a lot of consultations with people, and they come in and they're so concerned with their vertical lip lines, marionette lines, and then you kind of show them, you just push up the tissue and show them what their cheek used to look like, and they say, wow, oh gosh, I have lost a lot of fat there. You know?
Yeah, talk about the reaction that you're getting. Again, I think a lot more people coming and seeing what this can do.
Yes.
Reaction has got to be fun to see.
Well, it's immediate. I mean, there's nothing better than instant gratification. And when you go in the office, you know, it's about you're out in less than an hour.
So essentially, you could do this at your lunch break?
Yes. And with the mid-face, compared to other areas on the face, generally I would say there's not as much bruising and swelling. But, you know, there's always a little downtime with these procedures.
Now, how does it feel? I know people sometimes are a little bit concerned about pain or what. I mean, how does it feel?
I mean, I've had it done. I don't think it's very, there's not a lot of discomfort in my opinion. You put topical numbing cream. The injection has lidocaine. We use ice. And actually, after the first injection, the lidocaine takes effect, and it really is
that's nice.
quite comfortable.
Okay. And then is it done with typically other things? Would you just have a mid-face?
Well, what we call the liquid facelift is really a combination of Botox and fillers. So many people will do both. You know, we use Botox for the dynamic lines, the wrinkles between the brow and the forehead and around the eyes. And then we use fillers for the dark circles under the eyes, or to lift the cheeks, or for the creases around the mouth. So that's kind of the liquid facelift, but each person obviously is individualized, and it depends on what their needs or interests are.
Well, and talk about the age of the patients as well. I mean, you're still very young and beautiful, but you know, felt the need to get it done as well.
Yeah.
So this seems like it would cover a pretty wide age
I would
gap
think
too.
The younger clients are usually more responsive to the cheek, because oftentimes they just have a flattened cheek. It's not like a depression. So that's an easy correction, and that's really nice to do, because, you know, they do leave instantly looking very like rejuvenated and fresh. So
yeah. Well, and we have about a minute left. We're looking at a video of your office there. Is this something that can only be done at one of the locations of the office? Do you travel, Britton? What do you...
I do. I go to Bonita and Fort Myers, and the procedure can be done in either office.
So perfect, because I always love talking about that I think it's so nice that you have two different offices, and that's, I'd imagine, why you set that up that way, Dr.
Yeah,
Flaherty,
and in
so
most cases, these can be done the same day, you
Yeah.
know, so people make an appointment. If it's appropriate, they can have the treatment, and there really isn't any downtime with it. As Britton mentioned, these are injectables. Occasionally you can get a little redness or swelling, but in most cases people can go right back to work, and if they need a little makeup to hide the redness for a day or two, that's very doable.
Easy enough. All right, and then of course this is again just one of the many services that you offer. So best thing to do if you're maybe thinking about some other things, come in for a consultation.
Yeah, sure. And if you call and you have some ideas about what you want, that can be directed accordingly. Like if you're interested in fillers or Botox, you can meet directly with Britton and have the treatment the same day if that's appropriate. If you're interested in other services, the girls will be able to direct you in at the right spot.
Yeah, your staff is very, very helpful. So we always love having you here. Thank you so much for being here today, and we look forward to having both of you back.
Thanks,
so,
Carly.
Thank you. If you have any more questions about Dr. Flaherty and his office, just head to our website, foxformorningblend.com. And now is the time to go and see him, because he has a special offer on holiday gift cards. They're 15% off. So when you buy a $100 gift card, you will receive a total of $115. It's free money. So make sure you take advantage of those.
The Medicare deadline is only days away. Up next, last-minute help to ensure you and your loved ones have signed up for the right plan.